Okay, so I would just like to talk a little bit now about postpartum hemorrhage. So this can be something that could happen to you during labour or just following labour. So sometimes people have an episiotomy, which is where you might have a small cut and you can lose quite a lot of blood that way. Sometimes you might just be losing quite a lot of blood after birth. If it's really serious, you might even need to have blood transfusions. So if this does happen to you, then normally the hospital will give you some iron tablets. So I do strongly recommend that you definitely take those. You can do a lot with your diet as well. So eating blood nourishing food. So if this had happened to you and you came to see me, I would give you a big list of blood nourishing food. So it's really, if you eat meat, then it's kind of eating lots of meat, bone broth. If you don't eat meat, then really it's sort of taking some supplements. One of the best things for postpartum hemorrhage is actually placenta remedies. So either placenta smoothies, which I could come to your house and help you to make, or placenta pills will really massively boost your iron levels following a postpartum hemorrhage. That is actually the best natural remedy that you can get. Acupuncture can really support you as well. We can do lots of blood nourishing points with acupuncture. We could do moxa with acupuncture. It's also deeply relaxing, and really you need to rest as much as possible, which is not going to be easy when you've got a small baby to look after. So you really need to enlist the help of family and friends. It can take just to come around and hold the baby basically while you go to sleep, and it can take a while to build up those reserves. So what I have seen happen quite frequently is it's recognised that people may have had this hemorrhage and blood loss, and then they're given some iron tablets and they're sent away, and more often than not it's not checked again. So your iron levels are not retested. You've got a small baby, you are quite busy with them, and mum's needs sort of tend to come right at the bottom of the pile. But it's definitely worth, at your 6-week checkup, if you have had a postpartum hemorrhage or a heavy bleed, that you really mention it to your GP at the checkup and request another blood test just to see if your levels have gone back up again, because it can really, even breastfeeding just really takes its toll on your blood levels as well. So you don't want to be suffering with anemia when you're trying to look after a small baby. But placenta pills are the best thing for it, and second best thing for it is probably diet, and definitely the third best thing will be acupuncture.